Hello, everyone. This is Dr. Nisha Vishnu, and as usual, I'm here again with another exciting and important episode wherein we will discuss in detail as to what are the risk factors that, if present in our lives, puts us at a higher risk of having cancers. We will also talk about some things that we can do to reduce our chances of having a cancer, and then we will talk about cancer screening. So, what do I mean by risk factors? A risk factor is an aspect of behavior or lifestyle or a biological characteristics or an inborn or inherited characteristic or a health related condition or environmental exposure which has predictable effects on the risk of cancer. In the last video, we discussed about how there are some things which can act as risk factors but are not in our control, like age, sex, family history, genetics, menstruation at an early stage, late menopause, and stuff that is not known to us. While there is not much we can do about these things, good news is that there are several risk and causative factors that are very much under our control. Most important and most prevalent of them are unhealthy diet, sedentary lifestyle, avoiding breastfeeding, too much or too less sun, undue exposure to radiation, occupational exposure to certain chemicals, habits like alcohol and smoking or chewing tobacco, viral infections like HPV and hepatitis B and C, hormone replacement therapies, etc. One doesn't have to be a doctor to know that not only cancer but a lot of other health challenges can be avoided and even be reversed by modifying the above risk factors. And hence, in order to decrease the chances of cancer, we should work on these modifiable risk factors. That is, we should be eating a healthy, balanced diet, avoid sedentary lifestyle at all cost. For those it is applicable, breastfeed, at least for a year, avoid too much or too less sun, and curtail or better give up habits like alcohol and smoking or chewing tobacco. Why do I stress so much on smoking? Because our country is the capital of tobacco consumption. And if a recent publication in British Medical Journal is to be believed, we are now home to the second highest number of women smokers. No wonder we are the capital for head and neck cancers like cancer of the mouth, tongue, cheek, gum, etc. Once I went for a talk on smoking and cancer, and a gentleman interrupted my talk saying, "What, madam, my great grandfather was a chain smoker. He was as healthy as a horse, died at the age of 85." I said, "My dear friend, the lifetime risk of having a lung cancer in a normal person is 1.8%. The lifetime risk of lung cancer in an average smoker is 14.8%. That means the chances are not double, not triple, but 8 times higher in a smoker as compared to a non smoker. Your grandfather was lucky, but would you bet your life on a game where the chances of losing is 8 times higher? The estimated number of chemicals in cigarette smoke is 7,357, and out of these, 70 are confirmed carcinogens or cancer causing agents. Let's not also forget that while the smoker himself consumes all these chemicals, he or she also makes the friends and family the innocent victims of these chemicals through passive smoking. Imagine the lung of a kid who is in constant company of a father who is a chain smoker. The father might have picked up the habit at the age of late 20s, but the innocent kid is getting exposed to the cancerous chemicals from the tender age of 1 or 2. Do we need to do the math as to who is more prone to cancer? Like smoking, chewing or snuffing tobacco has a chemical called TSNA or tobacco specific nitrosamines, which is again a proven carcinogen. Around 90% of all the people who come to us with oral cancers are tobacco users. People who use chewing or any other type of smokeless tobacco have about 50 times greater risk of oral cancers than people who do not. Other than oral cancers, tobacco is also associated with cancers of the voice box, food pipe, pancreas, bladder, and more. But I do admit, in all honesty, that I do see on and off a teetotaler with no habits having a tongue cancer or oral cancer. Most of the time, these are associated with a chronic irritation from a sharp tooth or an ill fitting denture. Hence, it is pertinent that you get your dental checkups regularly and not ignore anything sharp causing constant irritation or damage or long standing ulcers in your oral cavity. Another very important thing about prevention is diet. I get asked a lot, would this superfood prevent cancer or would avoiding a particular oil prevent cancer? As a practicing oncologist, I haven't come across one scientifically proven superfood that has the power to guarantee a cancer free life. It only exists in the Instagram. What I want to underline here is balance, moderation, variety, unprocessed and natural, easily available. I mean to say the thumb rule to reduce cancer and cardiovascular diseases and many more hormonal imbalances is to reduce the processed food to the minimum, consume a balanced diet containing whole grains, pulses, legumes, lots of fruits, nuts, and vegetables, and even ghee or butter or oil in all in the right quantity as per your age, height, weight, and activity level, and other conditions present like diabetes or hypertension. What do I mean by processed or ultra processed food? These are industrially manufactured food with additives like modified starch, hydrogenated oils, taste makers, and chemical essences or chemical preservatives that are typically not used in our daily kitchen. We love them because they are convenient, durable, ready to eat, and tasty. Top examples: soft drinks, sweet or savory packaged snacks, processed meat, pre-prepared, pre-prepared frozen or shelf-stable dishes, and sweetened breakfast cereals, pickles, canned food, etc. There is a recently published study that is based on the data from the study called EPIC, that is European Prospective Investigation into Cancer and Nutrition, which involves more than 260,000 men and women from 7 European countries. In these countries, the consumption of ultra processed food is estimated at more than half of a person's daily food intake. The researchers discovered that increased consumption of ultra processed food is linked to an elevated risk of factors which may lead to cancer and cardiovascular and metabolic diseases. Now, am I saying that soft drinks is equal to cancer or pickles and cancers are directly correlated? Not at all. Honestly speaking, it is difficult to have a study wherein we could test the direct correlation of common food items with cancer, as cancer is multifactorial, multiple stepped, and complex. But it makes a lot of theoretical sense that repeated attacks on our internal milieu by artificial agents and repeated irritations could cause small damages which cumulatively may lead to abnormal growth and hence cancer. Now, when you choose your unprocessed food, choose variety. Why? Nutritional deficiencies are highly underrated in our societies. Other than the right amount of macronutrients like carbohydrates, fats, and proteins, our body equally needs the right amount of micronutrients like the vitamins and minerals. Pretty much like a car needing petrol as its major fuel, but the brake oil, servicing, and lubricants are equally critical. So, somebody eating curd rice 3 times a day may miss out on some of the important elements, vitamins, and fibers that fruits and vegetables can offer. Someone only on a fruit diet could develop dangerous deficits of essential amino acids and proteins. The point is not to go overboard with one thing. When we supplement our body with everything in the right quantity, with the right amount of sleep, exercise, and hydration, that is when it works optimally, wherein damages are absorbed and healing is optimal. There are certain specific vitamins on which we have more data with regards to its ability to cancers. One of them is vitamin D, not only preventing cancers of breast, pancreas, colon, etc. Vitamin D deficiency also affects bone health, making us prone to fractures, reducing our immunity, and hence interfering with our ability to recover from flu, heart attacks, diabetes, and much more. Sun is a double-edged sword. If one gets too much of it, chances of skin cancer increases, and too less, you already know. So what is balance? 30 minutes per day, 15 minutes for lighter skin. Best time of the day, 10 a.m. to 3 p.m. with at least 40% of the skin exposed to the sun. Why not take random vitamin D supplements? Because vitamin D is a fat soluble vitamin and can cause overdose. Hence, if you are curious about your vitamin D levels, please check with your doctor for a blood test and let your doctor correct if need be. Coming to exercise, 42% lower risk of esophageal cancers, 27% lower risk of liver cancers, 20% risk reduction in breast cancers, 16% risk reduction in the colon cancers, 13% in the rectal cancers. I can quote multiple studies which points out that consistently higher daily activity levels has been correlated with reduced chances of obesity, of course, and thereby all major lifestyle related diseases, including cardiovascular diseases and cancers, of course. What kind of exercise? The kind you like. How much exercise? At least 30 minutes a day or at least 150 minutes a week. The key is to integrate movement into your life, which means other than the dedicated 30 to 60 minutes of exercise in morning or evening, it is highly desirable if you take that stairs instead of the lift, walk smaller distances instead of cars, take up a small physical playtime with your kids or pets, etc. etc. Is there any vaccine that can prevent cancers? Unfortunately, there is no one blanket solution in the form of a vaccine to prevent all type of cancers. But some specific kinds of cancers is preventable by specific vaccines. One is HPV vaccine. There is a virus called as human papilloma virus or HPV virus, which is sexually transmitted. If a girl or a lady get exposed to this virus, it may cause a chronic lingering infection in the cervix or the mouth of the uterus and is the reason for more than 90% of cervical cancers. In men, it may cause penile or anal cancers. This HPV virus chronically infecting someone can be prevented by a very simple vaccine called as HPV vaccine. Ideal time to take this vaccine is before the initiation of the sexual life, that is 9 to 14 years, both for boys and girls. But there is a catch up period of up to 26 years and even up to 45 years until when it can be taken, as everyone is not exposed to all strains of the viruses in the initial years itself. A similar virus is hepatitis B virus, which can be transmitted through the bodily fluids either sexually or through blood transfusion or from a mom to a kid. Again, hepatitis B vaccine is available very easily and readily, and 3 shots gives you the immunity against this virus and hence against liver cancer due to hepatitis B infection. Talking about liver cancer, we do see some chronic alcoholics developing alcoholic liver cirrhosis and eventually liver cancer. Alcohol has also been implicated in causing cancers of the food pipe, stomach, parts of the large intestine, and the breast. So, herein we have discussed extensively about what all can cause cancers and what are the things we can do to prevent cancers. In my next video, I'll be sharing with you a few tricks to pick up cancer early on, and we will also be discussing as to what are the symptoms and signs of cancers. I would also love to provide you with an overview as to what we doctors do when a cancer patient comes to our clinic, right from how we diagnose to how we treat. Please do like and share my videos so that we can reach out to more and educate more. Thank you.